Well, good morning, everyone, and welcome to the Scottish Campaign on Rights to Social Security Challenge Poverty Week webinar, looking at the future of social security in Scotland. Absolutely delighted so many of you have been able to join us this morning. I think we have over 90 attendees from a broad range of organisations and backgrounds right across Scotland. So I'm looking forward to a really good session. My name's John Dickey. I'm Director of the Child Poverty Action Group in Scotland, a long-standing member of the Scottish Campaign on Rights to Social Security, SCORSS for short. SCORSS is a broad coalition of organisations with a shared vision of social security. Members work with tens of thousands of people across Scotland and have a diverse range of expertise and understanding of how social security policy and practice impacts on individuals and families across the country. What unites us and what's our strength is our united behind the belief that social security should not only prevent and reduce poverty, should not only treat people with dignity and respect, but should give people the resources to ensure that all our citizens are able to fully participate in Scottish society. We're really pleased to be hosting this event during Challenge Poverty Week. It couldn't be more timely. I don't think the current pandemic has thrown into sharp relief the critical importance of social protection, and the forthcoming Scottish parliamentary elections give us a real opportunity to fully debate what the future of Scottish social security should look like. So the aim of today's event is very much to map out a long-term vision of social security for Scotland, but particularly to look at those powers that the Scottish Parliament has and how they can be used over the coming years to achieve that vision of social security. Delighted to have a really strong lineup of speakers this morning. We'll kick off hearing from Moray Green of Citizens Advice Scotland, who'll give us an overview of the SCORSS principles and manifesto and our vision. But then we'll hear from each of the political parties, and delighted we've got Bob Doris, MSP, representing the Scottish National Party. We've got Jeremy Balfour, MSP, representing the Scottish Conservatives. Pauline McNeill, MSP, representing Scottish Labour. Patrick Harvey, representing the Scottish Greens, and Karen Lindsay, representing the Liberal Democrats. We'll hear from each of them for about 5 minutes, hopefully no more than 5 minutes, to give us plenty of time for discussion and question and answer. So just a few words of housekeeping before I introduce Moray. Just to say, as I say, each speaker will speak for 5 minutes. We'd ask you to be submitting your questions through the question and answer function at the bottom of your screen. And as I say, we'll then come back and take questions after we've heard from each of the speakers. Finally, just to say that we're recording the event and it will be available for playback after the event. So on that note, I'll maybe hand over to Moray just to give us an overview of the Scottish Campaign on Rights to Social Security principles.
Thank you very much, John. And as you said, I'm going to speak today about what the Scottish Campaign on Rights to Social Security stands for. The campaign's made up of the key anti-poverty organisations in Scotland and was relaunched in October 2019 during Challenge Poverty Week when we published the SCORSS principles. And that's what I'm going to run through today, first of all. So the first principle is to increase social security payments to a level where no one is left in poverty and everyone has a sufficient income to lead a dignified life. And that means that those who are ill or have a long-term health condition or are disabled should get additional help to cover the associated extra costs. It means that help with housing must reflect the real cost of housing for the individual. It means that there must be better financial and other associated support for unpaid carers. And in the longer term, our social security should secure everyone's well-being, and it should do this by contributing to everyone's income meeting at least the minimum income standard as calculated by the Joseph Rowntree Foundation, and adequately enhanced for those with additional needs. The second principle that SCORSS holds is to make respect for human rights and dignity the cornerstone of the UK and the Scottish social security systems. And this means that people's rights are put at the centre of policy and practice, with this consistently and effectively communicated. It empowers people to know their rights, it helps governments, public bodies and other organisations to understand and fulfil their obligations, and it creates avenues for accountability where rights are violated. And it also ensures that the design and delivery of social security take into account the need to incorporate measures which tackle inequality, discrimination and social exclusion, and the higher risk of poverty experienced by many of the communities in Scotland. And it ensures an adequate standard of living which does not push families into poverty or undermine autonomy over the number or spacing of children. Our third principle is to radically simplify social security to ensure it is easy to access and that barriers to entitlement are removed. So Scotland has got a complicated social security system with payments available from a range of agencies, the DWP, the HMRC, Social Security Scotland and also local authorities. We need to ensure that entitlements to social security are straightforward and are based on people's individual circumstances and rights. And we need to end the application of conditionality and sanctions, which is ineffective, complex, costly and stigmatising. And more consideration never needs to be given to non-means tested support because it's simpler, easier to administer and does not suffer the stigma often attached to means tested support. SCORSS' fourth principle is to invest in the support needed to enable everyone to participate fully in society. That means that we need to ensure an independent income which meets individual needs and entrenches equality within households. We need to make sure that parents have access to high quality childcare which allows them to work or to care or to volunteer. And we need to make sure that those who cannot work because they are ill or have caring responsibilities are supported and not forced into work or job seeking activities. And we need to pay people who work in the social security and employment support sectors a fair wage and treat them with dignity and respect. Because if employers are not treating them well, then they're less likely to provide a person-centred, rights-based advice service. And the final principle is to make social security work for Scotland. And in Scotland, that means to ensure that those areas of social security system which are devolved to Scotland are developed in line with the principles above. And at a UK level, it means to ensure that all welfare reform takes account of the different legislative framework in Scotland so that it is integrated with Scottish housing, childcare, education, social care, training and other areas of devolved responsibility. And in the longer term, we need to ensure that these principles underpin a new approach to social security wherever the powers lie. The devolution of powers over social security, especially those related to disability assistance, is widely acknowledged as the biggest transfer of power to the Scottish Parliament since its establishment in 1999. The Scottish Government is currently undertaking what they've described as a safe and secure transfer of disability payments, and the aim of this is to make sure that payments are not disrupted when they move from the UK Government to the Scottish Government. They're changing key parts of the system which have been problematic, but some other parts of the system will remain intact. SCORSS absolutely supports this approach as pragmatic, but has recently published a long-term vision for disability payments which sets out how the campaign would like to see the system develop beyond the safe and secure transition. And we've been having conversations with all the political parties in recent weeks about that vision and how we'd like to see it taken forward following the 2021 election. So beyond the safe and secure transition, we've called on the Scottish Government to initiate an independent review of disability assistance that is accountable to and co-produced with people in Scotland, including both those currently entitled and those who are not entitled to disability assistance. To take a human rights-based approach to the development of disability assistance, which will require a review of eligibility and the assessment criteria, and to ensure that social security for disabled people should support the right to independent living. It should therefore be adequate and take into account the extra costs that are associated with an impairment. And that whatever happens, a non-means tested social security payment for disabled people must be maintained. So in conclusion, I hope that during Challenge Poverty Week, we can all agree that Scotland needs a social security system that prevents poverty, treats people with dignity and respect, and supports everyone to flourish. I'm looking forward to hearing the rest of the panel's reflections on how we can achieve this.
Thank you very much, Mairead, for that very clear overview of the principles and vision that SCORSS has developed to date. Now is the time to hear from our politicians, kicking off with Bob Doris from the SNP to give us his perspective and his response. Bob. I think you're still on mute.
Is that us now? Okay. Thanks, John. Thanks for that presentation and for the opportunity to contribute to today's event. I should point out, I'm not speaking in my capacity as chair of the Social Security Committee, but that role is clearly important in the context of today's event. I should also mention that I'm also pleased to see Paul Neal, our Deputy Convener, and Jeremy Balfour from the committee also in attendance, as well as other political representatives. So I speak as a backbench MSP representing Mary Helen Springburn, who's a Scottish National Party politician, I suppose, John, as I get to grips with where we go forward with the existing challenges pre-COVID-19 and now the economic crisis that has been brought about in relation to that, not least of all, of course, when furlough comes to an end in a few weeks' time. When looking at poverty levels and what needs to be done, we should not ignore the positive steps taken by the Scottish Government to tackle some of these issues. But I have to say, in highlighting some of those issues, it's in full self-awareness that, of course, we need and must do more because we're swimming against the tide. But if we look at some of those choices that have been made, for example, for new parents and Deliver Best Start grant and foods, we can see families are supported to the tune of around £21 million a year in relation to that priority. The predecessor UK scheme was £2.4 million a year under Sure Start. Now, I draw that comparison not to remotely criticise the UK government, I should point out, but to draw those in attendance today that you have to help us set what our political and financial and budgetary priorities are going forward, and that was one example of that. Of course, another one would be the carers allowance supplement paid to 83,000 unpaid carers, worth £460 a year, but this year that would be £690 because of the additional money due to the issues with COVID. Another political choice that was made. And much has been made, not least of all with the Child Poverty Action Group, about the game-changing Scottish Child Payment. And again, we keep saying game-changing, we have to see it delivered and we have to see it make the impact that we all want it to see. But an important thing in relation to that, actually, is that we now estimate that 194,000 children will get Phase 1 payments, 14% more than the Fiscal Commission initially thought would get the £10 per child per week because of the increasing poverty levels and the qualifying benefit entitlement. So already I think we see the structural benefit of the Scottish Child Payment, because as need goes up, that targeted approach means that support will go up to those groups, and I think that's important. And it's now estimated positively because we want to get the money to children, but tragically because we wish children didn't need it, that once fully rolled out, up to 500,000 children might benefit from the Scottish Child Payment. And I wanted to say a little bit about food insecurity, actually, John. And Threshold Trust Chief Exec Emma Reevy was quoted as saying, "Hunger in the UK isn't about food, it's about people not having enough money." So whilst we look at social security, we have to look at the very basics people need to live on. And it would be remiss of me not to quote the Joseph Rowntree Foundation at this point as well, in relation to the £20 additional monies for universal credit that's currently being paid but will come to an end next year. The Joseph Rowntree Foundation said even with the emergency uplift, families unable to find work during the crisis will be on average receive £1,600 less per year in social security support than they would have done in 2011. And those with children will receive £2,900 less, making times even harder. So I'm just giving an evidence base to the swimming against the tide as we come together in Scotland to do what we can to tackle poverty. Now, I had a whole range of stats I was going to give you about how the Scottish Government was seeking to tackle food insecurity. I'm not going to do that. I would rather talk about other forms of poverty that we have to use the social security system to tackle. For example, digital poverty. And if we look at just how excluded I've seen constituents of mine get, you know, I've got one kid who's got their own room, has their own iPad, but families in my constituents, 2, 3, 4 children, sharing rooms, one device if you're lucky, shared in that household. There are other forms of poverty, including digital poverty, that we have to tackle. And I would note that the Scottish Government's put in £43 million to the Connecting Scotland Fund to get 50,000 households connected and £30 million to give laptops to children in the poorest areas. I think that's just a flavour of some of the choices that were made, but what I'm concerned about, because I see my time's almost upon me, is actually it's more about the choices we're going to make going forward. I said at the start of this, and I haven't mentioned evictions, I've not mentioned childcare, there's lots of things I've not mentioned. I'll pick up on all that during the panel conversation. I mentioned that I chair the Social Security Committee. We currently have a live inquiry. We have got a call for evidence on about how the Scottish social security system can move quickly to provide support, emergency support and substantial support with the COVID-19 economic crisis. We've also asked people to flag up what the barriers in relation to that are. I'm not going to mention those barriers this morning. As the SNP person in the room, I could wax lyrical about the lack of power and borrowing and control that we have in Scotland vis-a-vis the UK. But our inquiries about what can we do in Scotland, irrespective of the powers we have, what are the quick wins, and what can we do more of? So I'm really, really interested to hear your thoughts in relation to that. And of course, your thoughts in shaping all our election manifestos for May 2021.
Thank you very much, Bob. And without further ado, I'll hand over to Jeremy Balfour, Scottish Conservatives. Jeremy.
Good morning, John, and good morning, everybody. And it's good to, well, not be able to see you, but be able to at least speak to you this morning. I want to just cover 4 points and looking going forward to 21 and beyond. I think the first thing that we need to do is we need to deliver the devolved benefits fully into the new agency. I think one of the disappointments of the last 4 and a bit years has been the slowness in being able to do this. We are now not going to have all the benefits devolved. That has nothing to do, particularly with the present crisis we're going through. They wouldn't have been delivered even if we had been where we were or meant to have been today. And I think that is a disappointment, because we need the agency to be delivering DLA, PIP, attendance allowance, winter heating, etc. as soon as possible. These are the powers that we have in Scotland, and we're not using them fully at the moment. So I think we need to be able to deliver them quicker than is down at present from Scottish Government, and I think we need to push ourselves on as a Parliament and as an agency to do that. I think the second thing, and I say someone who is on PIP and who has been on DLA previously, I think there was, and I say this actually across all 5 of the parties in Parliament, a lack of radical thinking when these powers were devolved to us. And so I really much welcome the report to say that beyond 21, we need to sit down again and have a review of all the devolved benefits here in Scotland. And I would like to see that happen within a 12 to 18 month period. It has to be those that have lived experience. It has to be those who are academics, and it has to be those who are within the third sector who deliver this day in, day out. And I think we as politicians should sit back and say, you have a blank piece of paper, what would you deliver, or what would work best here in Scotland for these devolved powers? Because I think the comment made at the start is that we do have, I think, too many diverse benefits in Scotland, which is confusing for those claiming. My mum and dad are educated individuals. They knew nothing about DLA for children as I was growing up. It was never brought to their attention. Now, financially, we were in a situation where we didn't need it, but how many other people are missing out who do need it, because it's just such a complicated system. And so I think we need to start and say, what do we want social security to look like beyond 21 to the end of the 20s and into the 30s? Having said I want to give a blank piece of paper, I think one of the areas I would particularly look for this commission, for this body to look at, is DLA, PIP and attendance allowance. We now have, as within the UK, 3 separate systems. So DLA up until you're 18, PIP until you're 65, and attendance allowance 65 and beyond. Each have slightly different criteria, each have different ways you can claim it, and I think that is just confusing for people. And so I think we need do we need one benefit to cover from birth to the grave, or if we need separate benefits, how do we make it easier for people to transfer without having to make it bureaucratically difficult. And I think that would be true for other benefits I've been devolved. Can we wrap them up more together to make sure the right people are getting it? Because I think there's a real danger that people are missing out on certain benefits, either through lack of knowledge or through a complicated system that puts people off. The final comment, John, that I would like to make is around carers. I think, and again, I speak as someone who is only here this morning because a carer came in and helped them get ready. I think carers are totally undervalued, whether they are professional carers or whether they are family members or other people who give that care. And I think it's been very helpful that Marie Curie have brought forward a campaign in regard to supporting carers for a longer period of time once the person who's been cared for has died. I think that transition period, both emotionally and trying to maybe get back into work if that's appropriate, cannot be rushed. And to support those individuals for a 6-month period would seem to me an appropriate way forward, and something that is not just about money, but it's actually about giving the emotional and the professional support to be able to fill out CVs and everything like that. So those type of small things can make a big difference in people's lives. So I think we shouldn't be satisfied to see where we are at the moment. I absolutely agree the Scottish Government were right that we have to get these benefits done safely so the money is going into people's bank accounts. But I think the real challenge comes for us beyond 21 is what radical scheme can we take forward into a landscape that's going to be changing dramatically. Thank you very much.
Thank you very much, Jeremy. And again, I'll just go straight over to Pauline McNeill, Scottish Labour. Pauline.
Can you hear me now? You can, thanks. Good morning, good to see my Social Security colleagues at this event this morning for Challenge Poverty Week. I support the aims and objectives of the Social Security Rights Campaign, a system that prevents poverty and one that supports people at their time of need. It's also an important principle for those who paid all their working lives into Social Security should be able to rely on a decent Social Security system. So we've been building Scotland's new Social Security system for a few years now, and having served on the committee from the very beginning, I can certainly say that it's been a long and very technical process and has had many challenges along the way, not least in the transition from the DWP, transferring the powers to Scotland, and as you'll know, because of COVID-19, there's been a delay to that. So I've been proud to be part of that whole transition and helping to shape the principles of a new social security system that gives people more dignity and respect. The work of the committee could not be done without the Social Security Advisory Committee, because now the regulations that we're looking at are quite technical. But according to the Joseph Lindsay Foundation, Scotland is not on course to meet its interim child poverty targets within 3 years. 230,000 children now living in poverty, and workers in poverty being the hardest hit. By May of this year, claims for universal credit by single adults with no children had increased by threefold, and that couples with children had the claims had actually doubled. So we can see ahead challenges for anti-poverty and for the social security system itself. One of the reasons, in fact, I believe that the Social Security Committee's remit should be broadened to cover child poverty and poverty generally. And it was the work of the members on the committee the first years that pushed for the Poverty and Inequality Commission. And I think that should be part and parcel of our work. I think there's some issues I wanted to talk about going forward that could make a significant difference to the Scottish Child Payment that you'll be aware of, and applications open this November for starting in February of next year. And Scottish Labour would have preferred that the child payment was paid out sooner than that, and the government say that's not possible. But one of the issues that the Cabinet Secretary has already said she would explore, and I think it's important, and that is those who apply in November should have that payment backdated. So if your child is 5 3/4 when you apply in November, your child might have turned 6, and without backdating, you will not be eligible for any payment whatsoever. And secondly, I think it's really important to timetable, for the government to have a timetable to automate this payment. The government should be given credit for the automation of the child winter heating allowance. And I believe that the Scottish Government are committed to this, but I would like to see a timetable for achieving it. I think the Scottish Child Payment is right for being an automated benefit. Fiscal Commission projected the uptake was likely to be about 80%, where the government thought it should be 3%. But with that 80%, that should bring 155,000 children out of poverty by 2021. Just finally, John, I just wanted to look at the challenges ahead in terms of the poverty agenda. The role of the energy companies, in my view, should be looked at in the coming months, because as people pay more money for their energy, and many people losing their jobs and losing their incomes, it could be a bigger role for energy companies to put something in. Secondly, in housing, we need to tackle fuel poverty, and we need to tackle high rents in the private rented sector. For that reason, I'm still pushing that my bill on fair rents is considered in this parliamentary term. I believe it would have made a big difference if we could legislate to have some rate controls, and as going forward with many people, young people in particular, for whom home ownership will not be an option. Rents in the private rented sector is a critical part of bringing down poverty. Debt management is going to be really crucial as we go further into the COVID period. And lastly, I will be supporting Elaine Smith's bill on the right to food. Food is going to be a big issue for the anti-poverty organisations and tackling anti-poverty in the coming months. So there's a lot to do for all of us. And on that, I'll finish there and to look forward to the Q&A. Thank you very much.
Thank you very much, Pauline. And now hand over to Patrick Harvey for Scottish Greens. Patrick.
Thanks very much, John. Thank you for inviting me to take part in this discussion, and thanks to everybody who's put Challenge Poverty Week together. I think we need to begin with a fundamental recognition that the UK and Scotland do not have a social security system worthy of the name. The vision set out after the Second World War for the state to take on a role in looking after people from the cradle to the grave, that vision was never fully realised. But in starting to build it for a few decades, huge progress was made. I'm 47 now, and for most of my lifetime, the work of government has not been in building that vision, but in steadily dismantling it. And we now have a system which is more concerned with bullying people into low-paid work and often making it easier for employers to pay poverty wages, more interested in that than in looking after people's social security. If people had social security, there would be no need for food banks. There would be far fewer need for individual measures to try and stop people falling through the gaps, because there would be fewer gaps. We don't have a social security system worthy of the name. That hasn't stopped the Greens from trying to take small steps in the Scottish Parliament, even with limited power, to try and make the current system better, whether that's our work pushing for income maximisation schemes like the Healthier, Wealthier Children approach, which has the potential to put thousands of pounds into the pockets of individual families, whether it's trying to move away from conditionality and means testing and remove the threat of sanctions, whether it's taking other steps to try and improve people's incomes, like supporting the work that Pauline McNeill mentioned on the private rented sector, recognising that we should be pushing for a real living wage instead of the UK government's scam living wage, and indeed whether we should be using the tax powers as we now have to make sure that people who can afford to pay more do so, and people on middle and low incomes pay less income tax. We need to go further on all of these things. But taking those individual small steps to try and improve a broken system isn't enough. In the last 6 months or so, far more people have seen just how broken the system is. Far more people have come into contact with the social security system who perhaps never expected that they would, and they've seen how broken and unfair it is. I think many of them have seen for the first time how humiliating it can be as well. It needn't be that way. My party has long supported the idea of a universal basic income, whether we call that a citizen's income, a UBI, the principle that everybody needs enough money to live with dignity, and that actually if we reduce the conditionality, if we made sure that everybody has that without losing it when they choose to take on work or to spend time studying, caring, learning, or recovering from ill health, that would actually be incredibly empowering. It would allow people to make those choices. It would allow people to reskill. It would allow people to take the risk of starting a business venture of their own. And it would mean that nobody falls through the cracks because there are not those cracks in the first place. It would never take away the need for specific additional measures, for example, to support the additional costs of living with a disability. But it would give everybody that basic safety net. It would also hugely strengthen the negotiating hand of workers in the economy. One of the reasons why poverty wages are accepted at the moment is that people need them. If people don't feel that they have to accept a poverty wage because the UBI is enough for them to live on, they will have a stronger hand in negotiating for decent, fair wages for the work that they do. It's really heartening to see political support for a universal basic income growing across the political spectrum now, with political parties who previously been sceptical showing an interest. And I know that there are those in most of the political parties in the Scottish Parliament who see this as the way forward. There are positive and negative ways to implement a UBI, but I believe that that universal system, giving everybody the knowledge that their social security is guaranteed rather than conditional, is the only way to really fully complete that vision, which should never have been abandoned after the post-Second World War generation began it, of ensuring that the state has a meaningful role in protecting everybody from cradle to grave.
Thank you very much for that, Patrick. Just before we move on to our final speaker, just to remind you, if you'd like to ask a question to our panelists, the Q&A function is there, so please do type in your questions so that we're ready to go with questions at the end of the speakers. And on that note, I'll pass on to Karen Lindsay from the Scottish Liberal Democrats. Karen.
That better? Okay, sorry. Thank you so much for allowing me to take part in this and for putting this together. I think Lib Dems in our party constitution talk about a society where no one is enslaved by poverty, ignorance or conformity, and we really mean that. It's a huge mission and part of who we are. For me, the main principles of any social security system have to be, first of all, that is accessible for people in a way that works for them. The point at which you start to use something tells you a lot about its culture. So if the front door is welcoming, you'll feel safe. So we want to see an end to sending people who can't see 75-page forms to fill in, or expecting people without access to or the ability to use to access things digitally. That just bakes in unfairness from the start. The absolutely most important thing, and that's enshrined in the SCORSS principles, which I absolutely agree with, is that it treats people well and with compassion and dignity. It's got to deal with claims efficiently and quickly with the minimum of stress on people. And I see people every day who go through the absolute stress of trying to claim benefits at the moment, and it's what it puts people through is just terrible. And I think this SCORSS report on disability assistance has exactly the right approach, particularly in terms of human rights and looking at care throughout the whole of somebody's life. And one of the things that's really important as well is that you need to have a good system of challenging, because you would hope that a system developed on those principles doesn't make the wrong decisions as often as the DWP does at the moment, but it has to be easily challengeable. And people need to be able to access the advice services that will help them challenge. And we also need to keep evaluating and reviewing that the system is working as it should, and take action very, very quickly to remedy any problems. We've seen that coronavirus has exposed so many inequalities in our society. And I guess one of the silver linings is that we can maybe now build on public support to address those inequalities, to find ways to hit the people who are hit hardest. I think we need to understand and build our security system to tackle the structural inequalities in our society faced by, for example, young people and women and BAME people and disabled people. I mean, these groups are at greater risk of falling into severe poverty, and we need to take action to avoid that. I think the work that Engender has done on highlighting how women have been particularly disadvantaged by coronavirus, and how we need to ensure that we consider gender inequality and include things like childcare and care for those who need it as an essential part of the infrastructure of our society, and we need to invest in it. And I think we've seen that too many have had no income at all during these last few months. I mean, for example, the waiter in a restaurant who left one job and just happened to miss the dates for furlough in his new one. The person had a great idea for starting a new business and left their previous job too soon. People in the creative and events industries who are still struggling with no income. So the immediate question is how to help people who have been left with nothing pay the bills. And we wanted to see both the governments work together to adopt the principles of a universal basic income immediately during the pandemic, so that no one was left behind. And I think in the longer term, we need to develop a model that works so that people who need extra help with disability and housing get it. I mean, even before COVID, automation and greater job insecurity, I think, meant that we needed something like UBI. So we need to really look at the evidence and do what's best. I find it frustrating that we haven't used the powers that we have to the max so far. 3 years ago, I was hopeful that the people I help with PIP on a daily basis wouldn't have to go through that awful system at their next review. And I think they're still on that treadmill. I think we also need to continue the spirit of generosity of spirit in the way that we work cross-party on the social security bill. The government did listen and changed their mind on things like split payments, and it was like a good model for getting stuff done. Two quick final thoughts. I don't think it's too late to help the WASPy women. We have the power to do it up here. Some are really struggling, and we need to look at how we can help, perhaps in a similar way to the Scottish Child Payment. And also there's a massive link between obviously social security and housing. Decent housing is an integral part of tackling poverty. And I think it's also good for tackling fuel poverty as well. If we build more houses, Shelter and Chartered Institute of Housing indicating that we need 53,000 homes over the next Parliament, and that was even before COVID hit. And I'm just concerned that the Scottish Government's cutting the allocation for social and affordable housing by 20% in the next Parliament, and I hope they'll reconsider.
Thank you very much, Karen, and thanks to everyone for keeping more or less on time. That's much appreciated. It gives us 20 minutes now for questions and answer. As I say, if people out there watching would like to put in their questions on the Q&A function, we'll put them to the panellists. We've covered a lot of ground there, I think, covering what things have already been achieved within the Scottish social security system. No question from the panellists of the challenges ahead. the idea of the need for more radical thinking as we look ahead in relation to disability assistance and carers assistance, the need to, or the potential to, improve the forthcoming Scottish Child Payment, interactions with other areas of policy, energy, housing, childcare have been touched on, as well as the relationship with tax policy as well. So a lot to cover. We've got a couple of questions already in. The first one, and I'll maybe come to you first, Karen, to respond, and then on to the other panellists whoever would like to come in, is around carers' benefits. I think people have seen during the pandemic how important carers are, unpaid carers are, but also how undervalued they are. And the specific questions here is, what would the parties do to ensure more of those who look after family and other relatives in Scotland receive financial support within the Scottish carers assistance system?
One of the things that I know that a lot of people felt was unfair is that it only actually paid out to people who were already receiving carers allowance and not those with an underlying entitlement. And I know that there's a real sense of injustice amongst pensioners because they can't get carers allowance, or they can't get any help or support with caring. And I think particularly as you get older, your caring responsibilities do become more difficult, and I think we really need to address that. We need to look at this in much more detail and help those carers.
Karen, I don't know if others would like to come in. If panellists would indicate if they'd like to contribute on the extent to which carers assistance could be extended to more of those who are providing unpaid care in Scotland. Patrick?
Thanks very much. I mean, I hope that this is something there is a cross-party agreement that over the last 6 months or so, more and more people have seen the value of care in our society and the fact that it is undervalued. I think that applies both to those who provide care on an unpaid capacity with their own family members, for example. You know, in the current session, we've seen the Young Carers Grant as one example of how we need to do better on that. But it also applies to paid care. And these two things interact, of course, because one of the ways that we can give more support to people who undertake unpaid care is to give them services as well as to give them a financial income. And you know, it does strike me as astonishing that we have never had a debate really about you know, what the relative value of different forms of work are. Some of the work which is most socially and economically destructive in our society is some of the highest paid work in our economy. Some of the work which is so fundamental to people's well-being is treated as lowest paid, minimum wage work. We should be taking forward the momentum that there is now behind a national care service and ensuring that all paid care work is paid at a decent level, not just above the poverty levels of minimum wage, but as a decent career structure as well, so that it's an attractive place for people to spend their careers and develop their careers. And that's about supporting not just people who rely directly on those services, but people who currently are doing unpaid care work, whose lives could be so much better if they had a bit of access to paid care to supplement the work that they're doing.
Patrick, I think, Bob, you're wanting to come in here?
Yeah, just very briefly. First of all, wasn't the reason for coming in, but I'll just echo Patrick Harvey's comments. I think we will eventually get towards the political wills there, collective bargaining in the care sector as well. And I think that's very important. We'll still get the scars of collective bargaining in the further education sector. It was just the right thing to do. And we got there, and hopefully we'll now see the benefits of that. I wanted to come in about carers allowance and carers allowance supplement. I mentioned it during my contribution. There's been a 13% increase in support financially with carers allowance supplement, but actually the Scottish Government will move to Scottish Carers Assistance as a standalone benefit. in due course, and they will be consulting in relation to that. So it's a very tedious question, actually. I don't know the timescale around that consultation, but I think people are pushing an open door and thinking about different ways of paying carers allowance and how it links to young carers supplement as well. So that's the direction of travel. Carers allowance supplement will eventually go and it'll become Scottish Carer Assistance. I think that's just to make people aware of that. That's for the Scottish, that's the direction of travel for the Scottish Government.
Would anyone else like to come in on the issue of carers and improving carers assistance? Mairead?
Just to say very briefly that the fact that there's going to be a consultation on the Scottish Carers Assistance, I think, will be very welcome by SCORSS. It's something that has been identified by the organisations involved as needing tackled following the kind of impact of coronavirus, the kind of nature of unpaid care. We've not kind of formulated a kind of position on it yet, but we will certainly be doing that in the next couple of weeks, and we'll feed into that process when it happens.
Questions are coming in thick and fast, so I'll maybe move on to the next. There's been a couple of questions coming in around PIP, concern that the reduction in applications for PIP through the pandemic, and I suppose the question being, what is there immediate action that can be taken here in Scotland with powers over disability assistance to ensure people are receiving the PIP and are supported to claim PIP and receive what they're entitled to. Jeremy?
Yeah, I mean, I think obviously PIP at the moment, PIP, DLA, attendance allowance are still being administrated by DWP because that hasn't been handed over yet to the new agency. I think one of the issues is because of the lack of being able to go to places like the advice shop or CAB or places like that, then that is where it seems to be one of the issues. But I think it's important to say, if you can get your claim in, even if you don't, if it takes a while for it to be heard or a decision is going to be made, it is always backdated. So I think we should be encouraging people to get the claim in, and it can always then be amended and edited and added to later on. So I think that's the one thing. Obviously, there's no face-to-face interviews at the moment. They're being done either on paper or by telephone, and I think that is at least speeding up the process once the form is in. But I think one of the issues has been because of the lack of availability, because of where we are with CAB and advice shops, etc., there have been less applications going in. But I think the message we should be getting across is get the application form in, and then we can work on it once it's in, because everything can be then backdated. So I would be encouraging people not to hold back, but get that form in.
Would anyone else like to come in on this issue of how, in the short and medium term, ensuring people are able to apply for and get the PIP that they're potentially entitled to, and then I suppose longer term what we can do within the Scottish system around disability assistance? Mairead again.
Yeah, I just wanted to say that we'd seen a dip in the number of people seeking advice on accessing PIP early on from a citizen's advice perspective early on in the pandemic. The last time I looked at the stats, I think it actually started to go back up again, which is good. And I would just caution putting too much on the learning from the move to telephone assessments, because I think that has been good for some people, but the feedback that we're getting is also that it doesn't work for everyone, and that those can involve very kind of long and difficult conversations that are quite taxing for people. So I don't think it's necessarily a kind of an answer that can be readily adapted into the Scottish system, although there will be learning from it.
Pauline, you were wanting to come in as well, Pauline?
Yeah, I think my connection's a bit unstable. Can you hear me now? So just to continue on, I mean, it's quite alarming, the number of unclaimed benefits. And the Scottish Fiscal Commission had reminded the Social Security Committee that one of the reasons for that is the downturn in the number of advice centres and the ability to go and get advice. So it really happened, I think, during the anti-poverty week. I mean, that's one of the reasons why I'm pursuing the issue of automation and uptake. I mean, you'll note that there's a duty placed on the social security system to, on application of any benefit. And it's quite an important aspect of our social security system. It doesn't exist elsewhere, which is a duty on any or the agency to find out what other benefits you might be entitled to. And lastly, that's why I think the issue of automation might not be right for PIP, but is right for other benefits. If we can automate some benefits, then we will avoid this question of people not claiming stuff that they are entitled to. And that's why I think that the Scottish Child Payment would be
Thanks, Pauline. I wonder if anyone else would like to come in on this potential to automate more of the Scottish benefit system. So Pauline highlighting there in relation to Scottish Child Payment. One of the key principles of SCORSS is to try and simplify the system for citizens. Are there other ways, thinking into the future, that we can ensure that more people automatically receive the support that they're entitled to without the need for additional applications and assessments? Jeremy? And then, so I think Jeremy was wanting to come in, and then Patrick.
No, just very briefly, I mean, I do think looking forward, I mean, I think there are things we can learn from this about how we deal with people's claim and how quickly things can be done. And I think one of the issues is, and I think it's interesting, we have to find a way of assessing somebody which is best for them and which worked for them. And so I think there should be a number of different options, whether that's telephone, whether that's face-to-face, whether that is seeking other evidence from medical professions. I think we have got slightly into a kind of single track methodology at the moment. And I think one of the opportunities we have when the new agency takes this over is to have more of a different way of doing it. For some people, one way will work better than others. And I think we just got to be a bit more creative in how we do it.
Thanks, Jeremy. Patrick, you're wanting to come in on this as well?
Just very briefly, I mean, I think there's a danger in talking about automation as though it's only one thing. Reducing the conditionality of something, reducing the number of assessments, for example, that people have to go through, making social security payments more universal and thereby automatic can be very powerful. But automation is also used to mean applying more technology, and actually that can lead to additional complexity. That can be a barrier in itself. I have a great deal of skepticism about the use by governments plural, of more technology to automate systems, which end up actually becoming more of a barrier, introducing more complexity, and not actually achieving what people can achieve. You know, if we want people to feel supported, they're going to be more likely to feel supported by people working with people in a way that's empowering. That's very different than the tradition of you know, forcing people through assessments which are disempowering, humiliating, or stressful. But I think that different approach to how people work with people is probably more powerful than automating systems, which can often result in just a different kind of stress and a different kind of barrier.
Bob was wanting to come in just now.
Just very briefly, I think it relates to some of the earlier points about how we encourage people to uptake, of course, automation where we can. The committee's committed to that, to scrutinise that and make that happen where we can. But in terms of the statutory duty on Social Security Scotland to get people to claim the benefits they're entitled to, the committee's also looked in the past about how we get much more localised welfare and benefits uptake strategies, and there's always a wee issue there about should that be local authority led, should that be third sector led. Do they clash? Do they complement? Is it a multi-layered approach that we need? For example, the Scottish Government gave, I think it was about £14 million for the Money Talk service to Citizens Advice, and that's seen some really good results, but I'm conscious that's a national investment. So I think there's a debate to be had about how we get a coordinated, strategic and aligned welfare advice and benefits check and support for uptaking and claiming benefits at a local authority area. And I think that's a debate we have to have, but I'm conscious every time we have that debate, the sector very much has a disagreement with itself about, you know, we need multiple organisations to help those claims, because it's a layered approach you need, and other people are talking about streamlining and complementing and a more strategic approach. So it's not easy, but I think we do have to look at a local authority level, or even a more local level, about how we provide good quality welfare advice and support with the local authority, but not just the local authority.
Well, we're coming close to running out of time, but a couple more questions I'd be keen that we cover. The first one in relation to the way that young single parents are discriminated within the UK social security system, so receive less through universal credit than older young parents. Is there a role for the Scottish social security system to in some way make up for that, for example, through providing a supplement to the Scottish Child Payment? And I suppose the question is here, the specific question around Scottish Child Payment and it, but more generally, I suppose, the extent to which panellists believe the Scottish social security system should be acting to plug those gaps or make up for the discrimination or the gaps in the UK social security system. I don't know who would like to come in on that first. Pauline? Pauline?
Sorry, there's a delay when I try to unmute because I'm at an unstable connection. Yeah, I did answer it online just in case we didn't get to it for Manny Davis. I think it's a big question to ask as to why the government went for the child payment, and whether or not behind their thinking was that obviously benefits a lot of children, but we know from the Child Poverty Act there's specific mention of single parents as being one of the poorest groups, resulting in child poverty. So to me, there is the case for looking at whether or not an additional supplement is needed to get single parent families out of poverty. As I say, we haven't really ever got the reasoning behind why the government have gone for this option. As you know, they are required to report to Parliament about the progress they're making. So I think it's one of the questions that I will be asking when the time comes, as to whether that is the measure they thought was adequate enough to cover the poverty of single parent families, or whether we should go further. And I do agree with Marion in the question. I think particularly young parents, young single parents, there is an issue there about age discrimination, as there is across the social security system, not just in this regard, but in relation to housing as well, because they moved the age up to under the age of 35 as being in shared accommodation. So there are huge issues about age discrimination across social security, but I think this is one of them that does need addressed. Thank you.
I think Jeremy was wanting to come in, and then Patrick.
Yeah, I mean, I think one of the most exciting things we put when we put the bill through Parliament was that we created a power that allowed the Scottish Parliament to create any new benefit that they wanted to. And so I think going forward beyond 21, we as a Parliament, we as political parties, civic society, needs to have a debate on what type of benefits that we want to have and how those will work. Now, we do that within a context, as all pointed out at the start, that we're going into an economic crisis, and that we will have to decide how we want to spend our money and where it should go. Now, clearly, we need to target that, and we need to work out the best ways to target that. But we have that power here in Scotland at the moment. And I think if people think that there are benefits that should be created which are directed, that is something we should be talking about and having a conversation about, and not running away from.
Thank you. I think Patrick, then Bob.
Thanks, John. I very strongly agree with the sentiment that we should not have age discrimination in the provision of social security payments, whether in relation to young parents or indeed age discrimination in the minimum wage legislation. I think it's unjust, indefensible, and should go. But the deeper question, as the second half of the question comes on to, is should we be using the devolved powers merely to mitigate, to be a sticking plaster, to try and paper over the cracks of a broken system, or is our longer term objective actually to build a fairer system that is fundamentally more comprehensive? And we don't yet have the powers to do all of that. But more to the point, we don't yet have the political will to do it. Any political party who says we should be implementing new social security benefits altogether also needs to be willing to say we have to raise significantly more taxation. We can do that in a fair way, which takes from those who can afford to pay more and doesn't take additional tax from those who can't afford to pay it. But if we're going to have a more comprehensive genuine social security system, that will cost more, and we have to be willing to raise the tax to pay for it. And finally, this is why it leads me inevitably back to the case for universal basic income, because if we still have this them and us mentality, this idea that there are some people who take from the social security system and other people who pay in, then we're not going to build the political consensus that's necessary for the tax to be paid. In reality, we are all welfare recipients. We are all the benefit recipients of our society. We pay collectively for certain things that benefit us all. Every single one of us receives benefits that are paid for collectively. And a universal basic income would break down that artificial barrier that exists in people's minds between those who pay in and those who take out. We would all be in it together. That kind of phrase would finally mean something.
Thanks, Patrick. Before I come on to Bob to pick up on that as well, I just want to introduce the final question here on the issue of access to advocacy for support engaging with the Scottish Social Security system. So we've got a question here reminding us that the 2018 Act gives anyone who requires support from an advocate owing to a disability the statutory right to access independent advocacy. What needs to be done, in the panelist's view, in both the short and long term to make sure that this right becomes a meaningful reality? So I'll go to Bob first, as he was wanting to come in on the last question, but also open him up to answering the question around advocacy as well.
Okay, yeah, I did want to come in the last question. I guess the nub of what we're actually talking about here this morning. I did my best during my contribution not to, as I would love to have done, get drawn into a constitutional debate about where powers sit or how dreadful I think the UK benefit system is. I mean, clearly it's not fit for purpose. In my contribution at the start, I tried to give examples of where the Scottish Government's made a political decision to use the funds it has, be it mitigating the bedroom tax, whether it's council tax benefit that was cut to Scotland and we'll put that money back, whether it's Best Start grants, and of course the Scottish Child Payment's been mentioned. And these are positive things, but there's that debate: is it plugging the gaps and mitigating negative things that are happening elsewhere, or is it a proactive strategic approach about the kind of benefit system that we want to see? And I guess it's a bit of both, but I did want to address specifically the point I think Marion was making and Polly McNeill was talking about in relation to the Scottish Child Payment and what more could or couldn't be done, because I think that's a reality right now for getting money to where it has to be. Last year at one of these events, I walked in the room to talk about the Scottish Child Payment with fellow committee members, and immediately there's a whole swathe of asks to go beyond what was already agreed, and quite rightly so. Campaigners should campaign for more, but there was a big debate about is it young parents that should get more support? Is it more support for kids under 6? Is it more support for teenage children during the summer holidays? Where do you target that more support? So I suppose what I would say is, if as a parliament we can come together in relation to what the next big priority, because if you prioritise everything, as every politician tries to do you end up prioritising nothing? So I'm looking here within the current restricted powers we have within the Scottish Parliament and the restricted budgets at our disposal, because we don't have all the financial levers to say, if we were to find, I don't work at that pay grade, but if we were to find £30 million more, £40 million more, £50 million more, would it be to support young parents? Would it be to support parents of teenage children? Would it be for fuel poverty? Where would that money go? And I suppose what I'm looking for is a sense from the sector that if there's to be a key ask for additional spend within the confines we have within the Scottish budget, where would that go? And that's really difficult for all of you as well, because you all campaign for the bits you're passionate about, and as politicians we have to come to terms and prioritise accordingly. And I think that's what the Scottish Government's tried to do. On universal basic income, our committee's looked at it as well. We're keen to look at it further, but there's been an absolute intransigence from the UK Government being willing to look at it at all, and it would require all social security powers to come to Scotland, or it would require a joint approach between Scottish and UK governments. I see Jeremy raising his hand here. I should note that Jeremy's been quite supportive of discussing it at committee, so I'm not even making a party political point. We just want to explore that possibility. But without the financial mechanisms to raise significantly more cash, then we're restricted to the choices we make, and that denigrates the vision that we all want to see to tackle poverty at source. Finally, on advocacy, I remember when the legislation came through, giving entitlement to advocacy, the Parliament is really poor at doing post-legislative scrutiny and actually see what the reality of the legislation we pass is on the ground. And I think there's an important point there. We can pass the best legislation in the world, but if on the ground people are not getting the advocacy that they need, we have to look at that again. And I'm sorry, I've already taken up too much of your time, John, so I've just wanted to make sure I at least mentioned that there.
Thank you, Bob. Jeremy was wanting to come in, and then I think we'll come to Karen and then each of the other speakers just for a final word before we wind up.
Yeah, no, I just wanted to come on the advocacy thing. I mean, I think that is a really key issue, and it's a key issue that we fought hard for to have in the bill. Like, you can have that, and I think the only way that will work is, one, if we give enough support to the third sector so that they can provide that advocacy role. We need to make sure that we are publicising it properly so that people know where to go. And if I'm absolutely honest, I'm slightly concerned about the role of the Social Security Agency here, that they are not independent and they should not be the advocates on behalf. And I think we have to make sure that there's a clear understanding of what role the agency play when someone makes a new claim and what role the independent advocate has. And it's not the agency's role to advise people on how to go about making a claim and then taking that claim forward. That's for others to do. And I think the funding has to go to the third sector, and we should all be committed to making sure that the appropriate individuals at a local level are funded.
Karen, I don't know, did you want to come in here on this one?
Yeah, I mean, I think it's really, really important, as I said in my remarks, that people have the right to support and to challenge decisions, and advocacy is a huge part in that, and it does need to be properly funded to independent organisations. And I think as well, just to pay tribute as well to all the advice workers out there who during difficult circumstances in this pandemic are supporting people through the problem, because the benefit system has not stopped mucking things up during this pandemic, and and the people who are trying to help people get it sorted out is you know, I think the work really got to pay tribute to that. Thank you to all the organisations who are here today who are doing that.
Karen. Pauline, last word.
Yeah, thank you, John. I think it's important to acknowledge that there are many, many features in the Social Security Act that we'll need to monitor. The duty for the maximisation of benefits, for example, is enshrined in law, but we do need to make sure going forward that it is used in the way that it was intended. And there's a lot of provisions like that in the Act. that future social security committees will need to monitor, to standardising some issues in payments, for example, removing a need for certain assessments. So it's just, I suppose, different ways of dealing with benefits to ensure the maximisation of uptake. Glasgow is a case in point of that, where they automated the school clothing grant. It meant there was near 100% uptake of a really important benefit and helping those forward. If we can do that, something like the child. Thank you.
Thank you. You're beginning to break up again, but maybe move on. Patrick, I don't know if you want to pick up on the advocacy or any other final points before I give Mairead the final word.
Thanks again, John, and I will try and be brief. I think on this point, there are probably several issues that have been raised and points that have been made where there'll be genuine cross-party agreement, and I agree with several of the previous speakers. It's rare that I agree with somebody on the political right, but Jeremy makes a very fair point about the independence of these kind of services, and to have them part of the system that delivers social security doesn't achieve that independence. I would just say as well, though, that we need to be not thinking that it has to be delivered within the kind of confines of the way public services are delivered at the moment. In a lot of other countries, where the local level of government has the ability to raise resources itself, the kind of local services that support people, that give people things like money advice, don't necessarily rely on a grant from central government. You have the resources in local communities to provide those services at a smaller scale, at a more local scale, but without having to rely on central government providing the resources. And we have this very, very centralised approach to how public services, including through the third sector, are funded in Scotland and the UK. Decentralising that, I think, would very often not only achieve the ability of local communities to decide how they're going to deliver those services, but an independence in the delivery as well, that they are totally separate from the systems that they're supporting people to engage with.
Thank you. Mairead, just final comment from you.
Yeah, so I think Bob set the campaign quite a kind of good challenge there in terms of asking us to think about how the sector could come together behind specific gaps, and that's actually a process that we've already started to go through. And on disability payments, obviously, we're kind of a bit further ahead and we've set that out, and that kind of long-term vision report is there, and we'd encourage everybody to read that in the run-up to the election. But the other issues that we're kind of grappling with within the coalition and seeking to find shared positions on are around income adequacy, and the Scottish Child Payment obviously kind of features highly within that, because it's a very kind of powerful tool to target money to the people that need it most. It would have been great if it had come in prior to lockdown so that it was in place then, but you know, if we'd had that kind of crystal ball to know that this was coming, maybe that kind of priorities would have changed down the line. But I think the important thing is that the kind of financial impact of coronavirus is not over yet. We're definitely not out of the woods, and it will be really important going forward. So yeah, we're talking about that and what we'd like to see as a coalition and a campaign going forward. Also discussions around Scottish Welfare Fund and how social security operates at a kind of local level with local authorities, and also within the kind of local third sector, the support for carers. And I think the other thing that everyone within the kind of the campaign is agreed upon is the importance of human rights and social security. And of course that has to involve listening to people, empowering them to take part in decisions, and also making sure that they understand what their rights and entitlements are. So the advice and advocacy provision is incredibly important to that too.
Very much, Marie, and that brings us to the end of our discussion. I'm aware we've gone over the hour, so I really appreciate our panellists for agreeing to stay on for another 10 minutes. Really just want to finish by thanking all our panellists for giving up their time and for engaging in such a wide-ranging discussion. Really useful, as Morag says, to in terms of challenge back to all of us in terms of what the priorities for Social Security should be going forward. On that note, I would really encourage all of you who have been engaged in this discussion to, if you're not already members of the Scottish Campaign on Rights to Social Security, to join us. All it requires is an agreement with broad principles that underpin the SCORSS manifesto. So people can either through the CAST or Poverty Alliance or CPAG websites have a look at that. And if you'd like to join us, then please do get in touch. I'd really like to thank Neil Cowan at Poverty Alliance and his colleagues at Poverty Alliance for doing all the work in the background to actually make this event work online. Hugely appreciated. As I said at the start, it's part of Challenge Poverty Week. There's a whole range of events, activities going on this week to raise awareness of poverty in Scotland and to generate ideas for preventing and ending that poverty. Again, if you look at the Challenge Poverty Week website through Poverty Alliance, you can find out more about that. And on that note, really just to say thank you all for tuning in today, and thank you to our panellists once again. I'm sure if we're all in a room, we'd be clapping, so a virtual round of applause to everybody. And once again, thank you very much for your contributions this morning. Thank you.